Hello, how are you doing? I'm Kate Titus. Welcome to the Power of Tape. Glad you could join me for this. I'm looking forward to it. It's going to be a fun half hour, 45 minutes. I hope you enjoy it. I know your time is valuable, so let's go ahead and get started here. All right, here we go. Okay, as I said, this is the Power of Tape seminar. Um, and I am Kate Titus. I am the founder and owner of A Loyal Companion. At A Loyal Companion, we work with veterinarians and their clients and their patients to find mobility solutions that will support a pet's long-term quality of life. So we'll do things like orthotics, prosthetics, wheelchairs, strengthening, flexibility, proprioception work in the gym. We have a full-sized swimming pool that we do assisted swims in. So we really work with the dogs as certainly as well as we can, and certainly love every bit of it. Okay, let's enough about me. Those handsome kids there in that photo with me, that boxer is Helen. Wheelchair on with the pointy ears, that's Half Moon. He's our chief mobility officer. And on my right there is Andy. He is not a particularly good driver, so he doesn't teach other dogs how to drive. That's Half Moon's job. But he is a lot of fun to have around. Okay, so here's what we're looking for and where we'll be headed on our journey tonight. So we're going to talk, do a brief intro into kinesiology tape, how it works, contraindications, indications, sizes and shapes that you might use, the type of taping that's available, and I'm going to go through some case examples that we've worked with here in my facility, and then of course I'll leave some time at the end for some Q&A. So I want to be clear on sort of what tonight's going to be about. So we're going to do, like I said, a brief introduction. I'm going to give you a glimpse inside the mechanics and discuss the materials, the tape itself, and how it works. And I hope it's enough to inspire you to go and learn more, buy a roll of tape, play around with it, and see if it's something that will work in your clinic or can provide value to the dogs in your clinic. So at the end of the day, I hope you are able to understand those materials and mechanics, that you're able to assess a patient to figure out whether taping as a modality is a good idea for them. You will hear me say the term force vector force multiple times tonight. So understanding kind of how that works and what the purpose of a force vector is as far as how it affects the body and how the tape creates that. We're going to talk a lot about that. And then understanding goals and modes of action of the tape. Okay. Let's talk about where it came from. So Dr. Kenzo Case was a Japanese chiropractor and acupuncturist. And in 1979, he created what is now called kinesiology tape. His brand, he was smart enough to brand it all as well. So K-Tape is a brand that he owns and a copyright that he owns. He intended the tape to be like taking his patients being able to take his hands home with him, where they stayed on the dog or on the human. And it was supposed to support the effect of the body work that he was doing. So didn't really gain traction until the 2008 Summer Games in Seoul. And then we started to see the beach volleyball players with the black tape on their shoulders, on their backs. That was really where it caught the attention of the rest of the world and the veterinary world that, hey, this might be something. We could do some work with this. And that's when the researchers got involved and started doing more investigation on how the tape worked and the impact that it has on the body. Now, there's plenty of research on the human side, not a ton on the veterinary side, primarily because we have all different sizes of animals. Small animals, it's used a lot in equine therapy. And so those are a little bit different. It's a little bit more difficult to isolate the research on there, but I hope that more of that will come soon. Okay, let's talk a little bit about the material itself. So, um, kinesiology tape is cotton and breathable, and designed not to cause an allergic reaction. And there are elastic fibers that are woven throughout the tape. Um, Now, the one thing about this tape, multiple things about this tape as I unroll a piece here. Um, Lots of movement in this. So the tape can be stretched this way, and we're going to talk a little bit more about that later. So this is longitudinally. It cannot be stretched. If it comes off my fingers, we can't stretch it this way. It has no stretching on the width of the tape. And that will become important as we talk a little bit more about it later. Because this is cotton and with the weave, we also have breathability. So you have better and healthier skin underneath this tape. Now, one of the cool parts about the adhesive is that it's acrylic and it's put onto the tape in a sine wave. So you can see it's not just straight back and forth. It's not like a Band-Aid that has it spread evenly throughout the list. You know, when you have a Band-Aid on your arm or you're on your hand too long and you look underneath and it's all wrinkly and moist and where the adhesive was. This doesn't do that. This adhesive is also latex free. And when you're putting it on, it's heat activated. So that and we'll talk a little bit about this, but when you put it on, you're actually going to generate some heat by rubbing on it either with the paper backing or with your hands. I like to just hold on and squeeze it to create that. There are veterinary specific tapes that I like. I'm a big fan of Vetkin, which makes a really nice tape here. Multiple sizes, whether you need large for equine work or smaller for your dogs or even cats. I really like that one. Rock tape is another one. They have an extra sticky version that you can use. Canine K tape, which is Dr. Kenzo Case's brand. Those are great as well. So I would recommend that you kind of play around with the different brands of tape and see what works for you and what feels comfortable in your hands and the way you wanna be able to work with the tape. So the elasticity is absolutely the most important part of the tape. It works on the function of recoil. So the tape wants to recoil to the point of origin or the first point you put down. This generates the force vectors that we're looking for and those that create the outcomes that you're looking for. And for those of you keeping score at home, that's the second time I've said force vector. These are also, the tape is also like a Band-Aid. So it comes with a paper backing on it that you just tear and pull off. Okay, it'll roll right off just like that. So when it's laid on the tape is rolled out, it's laid onto the paper. So that paper backing, it already has about a 10 to 15% stretch in it. So it will start to come off of the length of the paper backing and start to actually back up a little bit. Every brand is different about how much elastic they put into the tape. So some brands will stretch 140% of the original length. Some will go up to 180. So understanding how much stretch is in the tape you're using will help you determine what sort of tension or help you get comfortable with how much tension you're putting on the tape when you're putting it on the animal. Now this is, I've had a lot of folks ask me, how is it possible that you can put tape on the fur of an animal and it makes any difference at all? Well, let me tell you, the furry animals have a whole lot more sensation over their hair or fur than humans do. So if you were to put this on your own forearm, which I highly recommend you just to get a feel for what that's like when you're putting it on an animal, we don't feel it as much. There are so many receptors just below the skin on our pets and on our patients than there are on humans. So it makes a whole lot more of an impact. So we'll talk a little bit more about that later. And the other thing that I should also say is, if you have questions, please feel free to post those in the chat section. I'll be happy to answer those as we go along. As I like to say, I'm a youngest child, so I'm used to being interrupted. Go ahead and key in any questions that you have. And if you're watching this as a replay, go ahead and put those in there, and we'll get back to you as soon as we possibly can. Okay, back to the presentation. It seems like you should just be able to pick up any pair of scissors that you want and this will work. Well, guess what? It doesn't work very well. So you need to have a dedicated pair of scissors, and they should be very sharp. Anything used to cut cloth should work just fine for you, but you don't want to go find your junk drawer and pull out the only pair of scissors you can find and expect to be able to make the cuts that you need to on this tape. Don't let anybody use your K-tape scissors, your Kinesiology tape scissors for anything else. Now, as you know, and as you've probably seen, the Kinesiology tape comes in a lot of cool colors, so blues, and pinks, and different shades of blues and oranges. You can see I've been drawing on that one. So there are theories about chromotherapy and using colors to cool the body or the muscles, warm the muscles, relax or activate. You decide how you want to use the colors. You can use them to indicate the mode of action that you're going to. So maybe you want to inhibit muscle action, so maybe that tape is red, or you'd like to encourage it, so that tape is blue or orange, something like that. So if you feel like there is an impact of color on a particular dog, or some folks will let the dog pick out the color, assuming that the dog knows which vibration they need. That's fine. Pick away and go with it. Sometimes we'll pick a color, it comes in black. If you have a dark dog and the owner doesn't want to have bright pink on their dog, then maybe we go with black and try to hide the tape. Others really want it highlighted. So go with your own gut or your own groove on that one. Okay, so let's talk about how this works. Now, lifting is an essential element of understanding kinesiology tape. So there's one simple rule that you need to follow, and that is everything that is stretched wants to return to its neutral position. This recoil will determine the way the body reacts to the tape and how you put it on. So if you think about, we put tape onto the dog. Let's work with the spine. That's an easy one. So we've got a strip of tape, two strips of tape down the apaxials of a dog. So when you apply that tape, it actually pulls the tissues as the tape is recoiling. It actually pulls the tissues and it kind of presses them together, right? If you can think about, having your tissues underneath, they kind of go into a bent stage like this, right? Once you get that recoil going. So once they've moved everything together, right? So when it started out like this and it starts to recoil and it comes back together, the only place that it has to move is up, right? It's moving away from the body, or up in this case, because it's the spine. So it's moving dorsally. This is the lifting. So that lifting creates more space in the tissues underneath. So this creates more space for the vessels, so they can get to a greater diameter. It creates more space for the lymph to move, waste to wash out of the area. It's just going to enhance the circulation and provide better delivery of nutrients and oxygen. So we've got more space for everything to groove within the tissues. This decompression effect is the reason that kinesiology tape can be used to reduce pain. Of, like, for example, hip dysplasia, because we can reduce space, we can create space and reduce the pressure that are on those pain receptors that are near the surface of the skin. So as you're thinking about where you're going to put your tape, how you're going to use it, think about how you can use this lifting and this force vector to be able to work to your advantage and create an opportunity for more movement in the tissues directly below the skin. So this is an example, and you'll get to hear about Frodo later, but you can see on the tips here, and I will tell you that I had to take these particular strips of tape off, primarily because I had tension on the anchor on the very end of it. You never want to have tension at your anchors, but this was such a great example of the lifting. The tape has actually grabbed a hold of the fur layer and is pulling that straight up. So Frodo was not reacting. Frodo was a Great Dane. You'll see him in a second. He wasn't reacting like he was in discomfort from this. The cool thing is that when we had this tape on him, he has a bit of a sway back. So we put this tape on, and all of a sudden, he's flatter, right? The recoil of the tape has caused him to tighten up a little bit and to flatten out his back. And he looked great when we finally got him taped up properly. And like I said, I'll show you that in a little bit. Frodo had some back pain here from some injuries when he was a young pup. But I thought this was a great image on how that tape is actually going to work for lifting. So we know about the lifting. So the lifting comes from the amount of stretch and the amount of tension that you're using to apply after you've applied the tape when you're putting it on. This comes from the power of the recoil. So you want to make sure that you're using the right amount of tension for the goal you want to achieve. Now, most of the tapes will come at about, like I said, 10 to 15% of stretch. This is called paper off. So when you take the paper off of the tape, and you get ready to apply it, it's already stretched at a 10 to 15% amount when you go to put it on, okay? So most applications are going to use this small amount of tension. So that would be, in my opinion, considered a light tension. So you're going to use that for things like pain relief, lymphatic drainage, fascia. So there are some muscle applications that you will use it for. Other applications like tendons and ligaments, you're going to use a little bit more tension. So maybe light to medium. And these are very broad and open to interpretation as far as term goes on what's light, what's medium, what's strong. As you work more with the tape, you will figure out what those terms mean to you. So is that, how much pressure are you putting on? And this is where playing with the tape and literally just I put it on paper, I put it on my own dogs, I put it on the table to see how much I can get it to stretch and what that feels like, because that would be, maybe that's the strong tension. So playing with the tape is really important. I'm going to show you a quick video in just a second on what that stretch and tension does. But light to medium for the ligaments and the tendon applications. Bones and joints, you're going to really look more toward medium to strong because we're actually trying to provide a little bit of support. And then the strong side, you're going to have that on when you're trying to provide that stability and support. For example, we'll look at that in a taping procedure for a CCL tear. And yeah, you can use tape to help support a limb while you're waiting on surgery, or maybe it's a custom orthotic that you've got on order. But in general, the rule of thumb is less is more. And the great thing is that if you feel like it's the wrong amount of tension, you just tear it off and you do it again. So you have some room to work and a little bit of play in that. So there's some, as far as durations and how long it stays on, I have read and I have heard 4 or 5 days. You should take it off. It should come off in a week. Others will tell you that as long as it remains active and attached and it's doing what it's supposed to be doing, so your goal is being achieved, leave it on. I will tell you that the longer you leave it on, depending on the coat of the dog you're working on, um, it can stay on there pretty well. And one thing I'd like to show you, this is a pain star that I put on Helen. And I left it on there for about 10 days. I wanted to see how she was going to do with it. But the important thing I want to show you is on the other side. Okay. This is why when you're going to take it off, you don't grip it and rip it, right? You don't grab a hold of it and just pull it right off the dog, because guess what? That's going to be uncomfortable. Now, Helen is a boxer Rottie mix, so I know that's undercoat under there, and we used a product called Ease Off. You probably have that in your clinic, probably use it for cats who had to be taped. You can use this to help get that adhesive to let go, but just be mindful when you're getting ready to pull that tape off that you don't be too assertive with that. So let me show you when we were talking about tension and stretch, let me show you this quick video. There we go. And there it goes. So you can see the longer strip is the greater stretch. You can almost see through that to the paper. The one on the far left, the shorter one, that's your paper off length. So that's about 10 to 15% of stretch. And this happens to be Vetkin tape, so my guess is they're about 140% would be about as much stretch as you're going to have on that. Okay, let's go back over here. All right, so we know kind of how it works. Let's talk about how to pick the right size and shape. So there are an endless number of shapes that you can use. I've picked 6 here to talk about. There are probably at least 6 more, and there are others that you can create to fit what your goals are. All right, so I've cut a couple of strips out here that I can show you. So this is a simple eye tape. This is probably the most common shape that you're going to see. You're always going to round the ends. I was not very good in arts and crafts, so I don't round the ends very well, but I do the best I can. But it's just a simple straight shape. This guy can create a vector force you can use for muscle, either inhibiting or activating, compression, decompression, posture correction like we did with Frodo. There are lots of uses for this very, very little simple eye tape. And then we look at the V tape. So this is just a single width piece of tape. Okay, came off of this guy. This is a very common width to use with a medium to large size dog. And I just made a cut in the middle. So now I have a V. So this one is great when we need to cover a larger area. You've got movement in multiple directions. It's great for fascia applications where you don't need to do any additional stretch. We also have the Y tape. So it looks pretty similar to that V tape, except I've got a longer anchor here. So I have more of a spot to be able to grab a hold down here at the bottom and then be able to stretch around it. So this is something you can use to straddle an anatomical structure, maybe cover a more triangular space. And you can create a force vector that goes in multiple directions, right? So we can have one here and we can have one here. And I'll show you a couple of those as we go along. So here's my X tape. So same thing. So I've taken just one piece of tape, cut at the top, cut at the bottom. So now I have an X. Okay. So that X again is something you're going to use for any sort of anatomical division. So think like a carpus. If I'm going over the carpus and I need to go around the accessory carpal pad, or if I need a way to go down and anchor on the other side, so I need to grab around the area distal to the carpus, that would be a good selection. And then one of my favorites, this is an H tape. So this was created, most commonly used with your bigger stretches of tape. So this one is going to be something, and we'll see an application of this in a cranial cruciate application. So remember, the tape normally goes this way. So that means this middle piece is not going to stretch. So this is the guy that's going to go over your tibial tuberosity. It's going to be there to provide support so that we don't have movement. Now, is it gonna take the place of surgery or an orthotic? No. But if you need a couple of days support until you can get that dog either into surgery or into their new orthotic, it's a good way to go. Now, the last one that I wanted to talk about is fan tape. So this one is great for lymphatic application. So you've got your anchor up here. So that's here. And then these fingers go down and they each form a force vector and help move the lymph up toward the lymph node. So you always want to put this guy up closest to the nearest lymph node, and then pull. These fingers will create channels and will draw that lymph up to the lymph node, helping to release that pressure. Okay, let's quickly go over some of the indications and the contraindications. Some of these we've talked about. Muscle and fascia issues, great for that. Osteoarthritis, either from a support standpoint or pain relief. Swelling and edema, we just talked about that. Joint stability, trigger points, scar tissue, tendon, ligament issues, as well as pain. Now, we do have some that we want to stay away from. So anything related to the skin, you need to be careful of and make sure that the dog in the area where you're going to be putting this tape, that skin is sound, and you don't have underlying pathology or any issues with the skin. So you want to be careful also with any immunosuppressed patients. Dehydration is another one. We don't have a lot of fluid in the body at that point. Fever, infections, never on a pregnant animal, especially around the abdomen. Malignant tumors, we don't want to be moving. We don't want to increase the circulation around those. Sometimes it's the hair length and the texture of the dog's coat that make it difficult to have the tape work. So you need to think about that. Excessive skin, so think about your Shar-Peis, English Bulldogs, how that's going to work. Are we going to be able to accomplish what we want to by applying it? And of course, you're never going to put it on the ventral neck. We don't want to mess with any of the blood pressure receptors there. Things you need to think about. No snackers. If you have a dog that you know eats bandages all the time, this is not something you want to put on the dog because they will get it off and they will eat it. So you want to watch out for the risk of ingestion. There is a potential for skin irritation, especially if you get it on incorrectly. So you remember that photo that I took of Frodo. That can cause some shearing forces and really irritate the skin as it literally pulls the hair follicles out. So you want to be careful about that. And also understand the impact that the circulation will have or may have on healing or medication related to things like diabetes, kidney disease, congestive heart failure, dermatitis again, lymphedema, anything like that. So be mindful of those things. Okay, so we're getting into the fun part here. So considerations, the targets and the goals. So what do you want that tape to do for you? What's the problem? So here's your first three things that you really need to look at. One, what's the problem? Is this a primary issue that you're looking at, or is this secondary or compensatory to the problem that the dog is having? Are there single points or multiple points that you want to target? And where are those? Are they on the trunk? Are they on a limb that you maybe have to work around? Do you need to connect limbs? Do you need to try to connect one half of the body to the next half of the body. There are taping applications where you literally go from the shoulder blades back down to the gastroc, because we're trying to attach different parts of the body. So, and in doing, and assessing the problem and the tissue, what's your goal? So what do you want to accomplish? Is that pain reduction? Is that relief from edema? Is that inhibit or activate a muscle? Increase awareness or proprioception? What's your goal? So knowing those three things will really help you figure out what type of taping you need to do. So there are more than 9. I'm only going to go briefly. I'm going to go through about 6 of them, and then we're going to talk quickly through a few cases that we've seen here at my facility. So pain taping. You're probably familiar with the gait control theory, but I'm going to go through it in a very simple way. It's obviously much more complicated than this, but this kind of helps set the tone for how it works for pain. So perception of pain is it's modulated by a gate mechanism in the spinal cord. So pain signals go from the point of the injury up to the spine, up to the brain, perception of pain. But that spinal cord has a gate. So basically it's a race to get to the gate. All the stimulus is racing to get to the gate. Whoever gets there first, that's what gets sent to the brain. So the idea here is that non-painful signals like touch or pressure, so we're talking about what tape would do, those ride on much larger nerve fibers that travel more quickly to the cord. So it's basically musical chairs. Who's going to get there first? So what we're trying to do with the tape is have those non-painful signals get to the gate first and inhibit the pain signals from being transferred. Again, this is very much an oversimplification, but you get the idea of what we're looking for. So that's one type of taping you can work on. So this is a joint here. Jasper has some discomfort on a carpus, so we are trying to provide some non-painful stimulus to beat any pain from that carpus up to the gate. Okay, muscle taping. So you need to have a good understanding of skeletal musculature, understanding origin, insertion, the direction the muscle moves, to make sure you get your tape placement right. But this is where force vectors really come in handy when you're trying to activate or relax a muscle. Because remember, that tape is always going to recoil to where you set it first. So that recoil is the force vector. So if I want to activate a muscle, if I want that muscle to be more engaged, then I'm going to put my first or primary anchor up near the origin. And then it's going to pull, and the final anchor is going to be at the insertion of that muscle that I'm trying to target. So it's going to be recoiling toward the origin and along the direction of that muscle. Now, the opposite of that is the relaxation. So I'm going to put that anchor at the insertion with the final anchor at the origin, and it's going to pull away from the origin, right? Because it wants to recoil back to the muscle along the direction in which it's stretching. So these are some examples of muscle taping. So here's Frodo. It's his back that we just saw. I only did part of his back in this photo, but he tends to have a pretty good sway back on him. So being able to activate, to be able to tape along those epaxials helped bring his spine more into a flat and away from that sway. This little cutie pie over here on the right with the best ears in the whole world, he had a bite injury. He was involved in a bite. He had turned into our local shelter. He actually had bite wounds across his back and his hips. So again, we're connecting the front to the back, but also providing some muscle relief along that spine. All right, decompression taping is, we're looking to decompress a particular area. So this is where you're going to see the layered tape applications. So like the pain star, the hairy pain star I just showed you of Helen's. So it's basically 4 pieces of tape that we were working with here. The first one goes on at a much greater stretch than the following 3 applications go, but it's eventually just pulling out the center, pulling up from the middle to create more space and to decompress that area. We're also looking at convolutions, and I'm going to show you in a picture here in a second. See the yellow arrow there? That's a convolution. You can see how it's kind of ripply, or we've got waves, and there's a pain star as well. That's kind of what Helen's look like. But those convolutions at the top of those, that's where we're getting even more space, right? We're creating some height and allowing, we're taking that pressure off of the nerve endings, which can be really, really helpful for that. So it's going to allow blood and lymph vessels to reach that full diameter that we're looking for. So increasing that circulation and allowing the area to be flushed out. This is great for osteoarthritis, trigger points, because it's going to decompress a very specific area. Showed you that one. Okay, proprioception taping. This is something that we do a lot here. We use a lot of eye-cut tape strips for this, but we're really looking to stimulate the sensory receptors, the proprioceptors, to let's get some traffic along those nerve pathways, getting them to the spine and then onto the brain. Remember that of those sensory receptors, about 60% of them are in the subcutaneous fascia. So we want to be able to activate those. We want to alert those. We want to alter that sensory input so that we can increase the dog's proprioception. Once we can activate that, we can get more accurate muscle activation and those patterns, which lead to a more controlled function if you think about walking. Okay. So that is our buddy who has IBDD. And then we have stabilization taping. So we're looking at at least a medium stretch when we're doing this. So it's commonly applied to places like places where we have junction. So TL junction, LS junction, SI joint. These are the ones that we want to put on, like I said, with that heavier stretch, that deeper stretch, so that we can provide we don't want that immediate recoil, right? We want to have the tape in its strongest point, not moving back toward its original anchor. We want to keep that stretch out of the tape. We want to put it on strong and leave it there. We can also use this on joints of the extremities like carpus, tarsus, elbow stifles, things like that. And this is where you'll see like a CCL taping. So here's Jasper again, sharing his leg. This is a carpal hyperextension taping. So we've got support along the back. These orange tape pieces are anchors. Are support anchors to keep everything in line. And we've anchored it underneath his paw. This is the CCL taping I was talking about. So the black marks that you see on here, proximal obviously is the hip, and then the one in the center, that is the fibular head, and then the malleolus down here distally. So and if you look at the photo on the right, you've got the greater and the lesser tibial tuberosity that are marked as well. So we've got the non-stretch portion of the tape. I showed you this H. So this is an H tape that you're looking at there. This part the middle of the H does not stretch. So we put that on there as tight as we can, no stretch on that at all. And then we wrap the arms up. So if you do any sort of work with orthotics, you will recognize the position of the orthotic shell is going to look very similar to what you see here with the oranges. We've also taken that H and turned it sideways. So that sits along joint center on the lateral side of joint center, and you'll see that the fibular head is right in the middle there, and that provides your support for the stifle joint not rotating any more than possible. Again, this is not a replacement for surgery. It's not a replacement for a custom orthotic, but it will buy you a little bit of time while you're waiting on either one of those. Okay, a couple more, and then we'll move on to some quick discussion on some cases. So lymphatic taping, you're going to use that fan cut. This is Kendra, so you can see her pink tape. And the other reason that I'm showing you Kendra is that we could not get the tape to stick to Kendra. Her German Shepherd fur was just not having it, and she's not really a dog that we want to spray any of the adhesives on that can help keep the tape on. She's had some issues, so we didn't want to add that in. But this is kind of what it's supposed to be like. So we're heading back toward the popliteal lymph node there. So that's the lymphatic taping. And then you can apply just real quickly on these last two using different directions of your forces. So if you get them going different directions as the dog moves, it's actually keeping the scar tissue from forming, or it can help break down scar tissue. It can also get the knots out of your fascia as well. The tape can be used for compression, can be used for wound bandaging, like an eye, cutting a circle, making it a cover for the eye. You can also do compression if you've got a dog that has, say, a hernia and you can't take them to surgery right away, things like that. And of course, hematoma taping, which is very similar to the lymphatic taping. So you're really just looking for decompression and allowing those blood vessels and your lymph to have more space to disperse. Okay, so let's talk about some case examples. This is my buddy Bandit. Bandit has LS disease, and he's got some paresis in the back. So we worked with Bandit quite a bit with the kinesiology tape, and he's actually moving much better. He's not dragging his feet as much, and he's also much more comfortable from the decompression at LS, and he's not tucking his pelvis nearly as much. So happy about that. We saw a guy, Frodo. He's about a 10-year-old Dane. He actually had both of his rear limbs broken at 10 weeks of age. So he has some decreased muscle mass in the rear, and his proprioception is not that great, but we used multiple taping applications on him. Most of them were along the epaxials, but we also did some proprioception taping from the tibialis all the way down to his digits, and that's been really helpful for him. And then we saw Kendra here. She's all kinds of well, she's a 14-year-old German Shepherd, so don't really need to say much more than that. But she's got some LS disease, bilateral CCLR, chronic CCLRs, and a possible DM. So the taping, we did our best with that. She's one I wish that I could do more for her. And this is Harold, again, ataxic, IVDD, and he's got some paresis and ataxia and some knuckling. But let's look at an early video of Harold walking. So there's Harold. You can see he's a little just not quite sure what's happening with those back feet. But if we look at him with his tape on, much better gait, much more under control. He's a really good example of how he handles the tape really, really well. And it's certainly, sorry about that, it's certainly helpful. It's been helpful for him as far as being able to walk more efficiently. We've been able to get the tape off of him pretty well. He's long-term pred use, so he's got quite a bit of hair loss. Now, Ranger has been a very interesting case in that when he stands, he doesn't keep his back straight. He tends to curl to the left-hand side. Sorry, I had to think about it. So he's very tight on the left portion of his epaxials, so they're so tight they're pulling his hip around to the left. So we did some tape on him, and he's now walking and standing squarely, which is pretty amazing. Here's a video of him walking. You can see the tape work. You can see it stop. You can see it stop the turning, and you can see the way the force vectors are working on his back. If we see that again, you can see one set of tape. You can see the convolutions in the pink, but the blue seems to go straight. The one on the left-hand side, I'm going to show you one more time. Maybe. There we go. Here we go. You can see really, really keeping his back in alignment. His mom has been super excited about how much correction we've been able to offer him. And because we've been able to keep his posture in a straighter, more square alignment, he's actually moving better. His confidence has gone through the roof. He's walking more and longer distances. So I've been really excited with the progress that we've made with Ranger. And there's Patches. He is 14 and a half. IVDD case, also is unlucky enough to have spondylosis, and his rear limbs have not been working super great, as happens with IVDD. So he's had some knuckling. You'll see a 2-engine gait on him, but the tape has really, again, helped with the confidence and being able to move well and more efficiently. And then this is Cooper. So the last 6 months, he's had a lot of difficulty rising. He has osteoarthritis in his hip. He's also missing a digit on his right rear paw, and you can see that outward rotation of the right. He's been pretty uncomfortable, but the Pain Star has been helpful in decompressing that area and giving him some more, giving him some relief and some option to be able to walk more efficiently with less pain. So this is Maisie. She was an interesting case. She came in 10 weeks post-op of I actually wrote that down. It was a TPLO. And she had some patellar ligament dysmopathy, and she was not moving well. In fact, let me show you a quick picture. This is the video of her when she first came in. So she's 10 weeks post-op from a TPLO. She should be walking much better than that.
You're good.
You can see she's really tender on that. Okay, so she came in a week later. We taped her again, came in the 3rd week, and this is her now. We've got the pressure off of that tendon. We stopped the pull, used a force vector to stop the strain. So to stop the quad group from shortening, we needed it to lengthen out and relax the pressure on that tendon. Had some great success with Maisie. She's now moving really, really well, doing a nice square sit. Great down to stand. She's just moving really, really well. So I've been happy about that. So these are, thank you for again for hanging with me. I had some resources that I'd love to share with you. Amy Hesbach is fantastic. I saw her speak at the STAR conference. If you haven't been to the STAR conference in New Jersey, I highly recommend it. She taught a great 4-hour course on taping. She also has a course on Teachable that you can watch anytime. So just do a Google search for her name and Teachable. There are a couple of books that have been great references that I've really liked. So the Kinesiology taping for dogs, this one, and then this is the second one. Both of those are on your list there. If you're a part of online health, onlinepethealth.com is a membership. Solange has a great video presentation on that as well. Vetkin, which is the brand of tape that I prefer to use, they have a lot of great resources on their site. So please feel free to take a peek at that. We had a couple of questions come up. Let me put this one up here. Is this even possible on long-haired dogs? That depends on how long is long. A pulley, probably not. But one thing you can do, we've worked on a Great Pyrenees. So when you lay it down, you want to spread the hair so that you can get down as close to the follicle or the point at which the hair comes off the skin. It doesn't matter if the tape is floating, right? If it's not sitting flat directly against the skin like you would see on, say, a boxer or a pit bull, something like that. You can certainly do it on a German Shepherd. You just have to be mindful of where you're trying to do it, what goals you have. Like stabilization taping, I think would be much more difficult on a dog that has longer hair because you can't get down to the source. You have to, you're going to end up staying on top. I hope that answered your question. Next question from Kari, is shaving the fur an option? Yes, that is an option. That depends on, obviously, that depends on the owner. You also want to be really careful that you don't shave it down like a surgical shave. So then you're left with irritated skin that you're putting on a super heavy duty adhesive on. So taking that off would be a nightmare. So you don't want to go all the way down, but let's say you're doing a golden retriever. If you get the hair to say maybe an inch, half an inch, yeah, then you can get a better hold on it. It just, you want to be careful when you talk about shaving. You want to be careful about too much irritation to the skin, because that is a problem, and you can have some shearing when you have that. So you want to be mindful of that. And then Connie had asked about the purpose of the blue tape on Ranger's back. I put on 2 different colored tape because I wanted to be able to differentiate which way we were pulling, right? So where's my origin and my insertion? So I used different colored tapes so I could see that on a video, so I knew which way I was pulling. So if I go back, hold on with me here while I go back and look at Ranger. Let's bring up his image here. So if I stop this right here, so Ranger wants to shorten the blue side, and the pink side of the back group are stretching. So I have put my anchor on the bottom, so on the more caudal aspect of the tape, because I want that force vector be coming from the cranial to caudal. The pink would be the exact opposite, because I want to straighten that out, right? So I don't want that to be lengthened. I want that to be tightened. So I'm going to go from origin to insertion on that one. So from cranial to caudal on that one. So the different colors just help me visualize what direction I'm moving thing. I hope that answered your question. Oops, let me get back down here to my other slides. There's my resources. Oh, look, there was my question and answer screen. If you have any other questions, please feel free to put those in. If we don't get to them tonight, I'll certainly answer those at a later point, also known as probably tonight. So go ahead and put those in. Okay, so here's another question from Kristen. Seeing your patients every 4 to 5 days to change tape. Would like to have the clients come in more often to check the tape. The way my clients work, I usually see them on a weekly basis, like you did. I would not have them come in more often if the tape, I don't get too wrapped up in the tape. If the tape comes off before our next appointment, great. I don't ask the clients to take it off themselves. I think if it comes off great, that means the tape's job was done. If it doesn't, and it's been on there for too long, then we'll get out the ease off, and we'll get that tape off of there and put some fresh stuff on. So I don't have them come in more often to check it. Now, if we have a dog who I know has some questionable skin, but we need to put the in other parts, not on the part where we're working or the incident point, I'll be really careful with those, and I'll actually call and check on them or ask the owner to take a picture of the tape so I can see it and see what the skin's doing. But no, I don't ask them to come in more often than just that once a week when I'm going to see them. The other thing is, if you work in a clinic that has any sort of water therapy, you really want to wait a half an hour before these dogs get wet to make sure that tape stays attached. And before you put it on, it's always a good idea. It's always a good idea to have those muscles warmed up. So if you're going to be doing therapeutic exercises, do that first. If you're going to doing massage, do that first. Then put your tape on. We had another question about cauliflower ear. That's a maybe. I have not had anyone ask that question, but we're talking about, usually cauliflower ears is caused by head shaking. There's a potential, I think, yeah. You know what, Dawn, let me, I will look at that one and I will post the answer to that question up on the video so you can check in on that. Don't really know the answer to that one completely. Okay, so if you have, like I said, if anybody has any questions, go ahead and post those in there. But I've kept you a little late for that. I'm so sorry. But we have some upcoming sessions. So we're going to be talking about the canine cart, which, believe it or not, can be controversial. It's a tool. It's not a crutch. And that's what we're going to be talking about on March 20th. We'll do probably a 40 to 50 minute talk on that. And then May 1st, which is National Specially Abled Pets Day, which is one of our favorite days around here, we're going to talk about seniors and quality of life and why it's important to talk about it now, not as part of an end of life discussion. So I hope you can join me for those. In the meantime, would love for you to connect with me. All of these different ways you can do that. Primarily, you can reach me. There's my email address, learn.aloyalcompanion.com. That is our Canine Mobility Resource Center. Feel free to check in there. You can check at our Facebook, Instagram, LinkedIn, and YouTube. Any of those would be a great way to connect. And thank you. I know your time is valuable. I appreciate you spending the time with me today, and hope to talk with you soon. Thanks again.